All right. Welcome, everyone. Welcome to the very first Advocacy Days. The very second, apologize. Welcome to the second Advocacy Days on housing. Love that you're all here today. Just a little housekeeping items. Please remember to go down to the little globe and pick your language. You can pick either English or Spanish as your options. So if you haven't gone down to the little globe, just go right down there and you'll be able to do that. It's good to see you all here today. I am Ivanova Smith. I am your self-advocate MC. And my other MC part will be with us shortly. And the first thing, first we want to see how many people here today are from just let us know where you're from in the chat, or I'm glad hopefully we have a lot of people from around the state here. Those from Pierce County, King County, Olympia, Ellensburg, Vancouver, also Seattle. Welcome, Seattle friends. South Seattle, Clark County, Clark County. Looks like Fairmont, Port Townsend. Hey, welcome from Port Townsend, Olympia. Really, thank you for all those who posted where they're from. That's really helpful. King County, woohoo for King County. Awesome. Southeast, Woodinville. Awesome. Welcome, Woodinville folks. All right. Oh, and welcome more people coming in. Welcome. If you haven't already, please make sure to go to the little globe, pick your language. Welcome those from Spokane, woohoo, East Side, South Kent. Welcome from Kent County. All right. And welcome to those who just joined us. We are just getting started, just like seeing where everyone is from, and it looks like we got great responses in the chat. So thank you all for doing that. And woot for all of those epic places that we are all from here in Washington State. Now we're going to introduce the next part of our agenda, and that is the North Star Housing. And we're going to hear from the housing sub-work group to North Star, their co-facilitators, Anthony Nash and Courtney Thorne. Take it away, y'all.
Hi, everyone. My name is Anthony Nash. I'm one of the co-facilitators for the North Star Housing Work Group. And we've been trying to work on how we can get people from RHCs into community living. And we actually are trying to work as much as we can on saying we need to focus our budgets on housing and community living for people with IDD. Okay. Is there another slide? All right. All right. Yeah, because our whole North Star, as you see, has eight subgroups and one big group, and housing is right on the top. And we work as much as we can trying to get everything done. And housing has always been one of our biggest, because, well, advocates all around Washington want to close the institutions and have community supports so that they can live free and independent. Is Courtney wanting to say anything?
You've been doing great, Anthony. Just keep going. And I'll just read the three things that we're bringing to the legislature, to the Housing Rec Group.
Well, I pretty much just explained what our mark is on it. I'll be talking about another thing, so go ahead.
Okay. So the three things that we're bringing to the legislators is asking the legislators to create a 3-year plan to close all state-run institutions. That'll be on Senate Bill 5268. Same with the provide case-of forecasting for DD housing. That's on the same bill, SB 5268. The third thing that we're bringing to the legislators is to invest $120 million in community-based scattered site housing over the next 3 years. And it's the same bill.
And can you explain what scattered site housing is, Courtney?
It's just like case-of forecasting. So scattered housing is just like case-of forecasting, but in a different way. That's how I see it as. And Anthony can say more about that if he wants to.
No, you did good on it. Let's see. And there is one thing that when I was one of the main facilitators of North Star that we got progress on, thanks to Senator Randall and Representative Taylor, is they are partnering to create a caucus called the DD caucus, where it will have both Democrat and Republican, House and Senate, and how we've always, like, through decades and generations of self-advocacy fighting for our civil rights, with all our bills scattered, this caucus will focus all our bills into one team, to a dedicated group of legislators who will focus our voices in the legislature so that we can get more bills passed. So I like to put out a special thanks to Senator Randall and Representative Taylor for doing that, because that will help us in the future advocacy movements to come. And in time after they construct that, they will construct a community-based focus groups for people with IDD and other parties of interest, so that we can so that the community has their 2 cents into talking to the legislators, so that we don't always have to do everything we can to reach, like, the reps and everything. We can have, like, focus work groups that can, where things will be delivered right into the DD caucus.
Welcome everyone to Advocacy Day.
Oop, what was that? But that's the announcement for the DD caucus.
And I wanted to share the rally flyer. I have it up on my computer. So Diana, can I share my screen?
Share your screen for what, Courtney?
For the flyer for the rally.
Okay, yeah, if you want to talk about that for a minute.
Yeah. I am sharing my screen for the Southern Down rally, where this is going to happen next Wednesday on the 26th. Southern Down Coalition is hosting this along with SAIL and other DD networks. The Arc of Washington is also helping also. And the rally will take place at the state capitol steps in Olympia on January 26th. The rally will be from 1 to 2:30. And the volunteers will be help signing up at noon. And if
Okay.
you want to attend or be there virtually, to RSVP by January 12th and email Jessica or Sean Latham.
Okay.
We have
thanks.
been planning this rally committee for quite a while. We even formed a rally committee also to have this planned out perfectly.
Okay, thanks, Courtney.
Thank you, Courtney.
So do people have questions about the North Star group on housing for Anthony and Courtney?
Any questions, anyone? Let's see, I'm gonna look for raised hands. I'm not seeing any.
Kyle has.
I just put my hand up. So
Go
first
for
of
it.
all, Courtney and Anthony, you did a great job. I'm one of the co-facilitators for the next 3 months or to get us through the legislative session. And this is dire need because we need a spot for when the we have over 700 people, like majority of the people are pretty much ready to go, but they don't have no place to go. And if we can be able to, as we're trying to think, and Senator Braun is going to be bringing a great package to help to reduce it by 20% over the next 5 years to make sure that it will be a close so that it eventually does close. And now we just got to get in place some housing options, et cetera. And that's a great thing. Thanks. Reaction.
Thank you, Kyle.
You're
And,
welcome.
just a reminder for all the new people that have been joining recently, make sure that you go down to the bottom of your screen where all your choices are and click the little globe and choose English or Spanish, depending upon what language you want to hear this in. Otherwise, you get kind of a mix of both. So make sure you go down to the globe and choose either English or Spanish for your language.
Hey, Diane, really quick, Gabriella's here. And we have
Okay, thanks.
2 other hands up. Carrie and Margaret Lee Thompson.
Thank you,
Ivanova?
Anthony. Hi, everyone. Good morning. Sorry for the delay. Taking my son to school, something on the road happened, but I'm here, sound and safe, and ready to join you.
Sound and safe.
Thank you, Ivanova, for doing such a great job.
No problem.
Gabriella?
I'll let you take it away.
You want to call on the hands that are raised, Gabriella?
Yes, thank you, Diana. Okay, I saw Carrie had her hand up first, and then Margaret.
Hi, I have a question about, or need to clarify the whole movement toward the quote unquote nursing home on Fircrest campus, how that fits into the bigger plan around closing the institutions.
Who would like to answer that question?
Well, this is Diana. Carrie, the plan is that they're still working on the plan to even build that yet. But there is a bill coming out from Senator Braun this session.
Thank you, Diana. Oh, you're in mute now.
Sorry
Yeah.
about that.
Now, Margaret Lee Thompson has a hand up.
Well, may I just ask Diana to say that again? There's
Yeah,
a-
sorry, Carrie.
No, that's fine. So Dr. Braun's, I mean, Doctor.
Senator Braun is proposing a bill. It's already written. We're just waiting for the bill number that would put a plan in place to close all of the institutions over like a 3-year period of planning
That's
to
what,
get
okay.
that done. So I believe that that would probably be included in there. You know, it's still, as far as the legislature is considered, it's a done deal. They're going to create it. But we still got studies that they're looking at homes in the community for nursing. And if we can convince them that it is cheaper and healthier for people to be in their own homes and get nursing services, we may be able to switch that. It's still a conversation we haven't given up on.
All right. Thank you so much.
Yes.
Thank you, Diana. And we have Margaret. Do you have a question?
I just wanted to make sure that I think that Diana just cleared it up, but there will be this 3-year plan to close the state institutions will be coming out, and it will not be in 5268. Is that correct?
Correct. It will be a separate bill number. We've already seen the draft language. It just hasn't dropped to get a bill number yet. As soon as it does, we will post it on the bills page on the website.
Perfect. Thank you.
Thank you. And there are a few comments on the chat. We'll read them. Although Stacy already got back to one of them. I have Ramona says, I have a question. Is the 3-year plan and scatter the site housing in the current version of 5268, or are there amendments we are still trying to get in? Stacy says there are no amendments to 5268 yet. Andrew Young has a question for group homes. And Stacy North Star has requested several amendments to 5268 to address closure of other issues, but there is now a separate dual service bill and will likely be separate bill to close RHCs. So not sure where amendments stand. I think the thinking is that we want to preserve caseload forecasting as the focus of the bill and not bog it down, sorry, since the House has been challenged on this topic. I don't know, do you have any anything else to add, Stacy, or any questions or comments on this?
Sure, and I can just finish the other thought on the housing. So there are a couple of general housing bills that Representative Macri has floated that have things that sound like they're for us, below 30% AMI housing and what she's calling middle housing, which is sort of an integrated model of housing within a larger
I'm
complex.
sorry, Stacy, can you please slow down a little bit for interpretation? I
Yes.
apologize.
No, it's my fault. I apologize. Do you want me to repeat? So did
Yes,
you get
please.
that?
Could you please repeat that? Thank you.
Sure. So right now, 5268 is looking at some amendments potentially, but because we have these separate bills, it's so far there has not been a full amendment proposed. On the housing issue, Representative Macri has floated a couple of bills. They seem to address some of our needs. So they mentioned things like housing for individuals who are below 30% AMI, which is average median income, and that is most people who live on Social Security. And there is some language in the bill that refers to middle housing, which is smaller kinds of housing, like scattered housing within a larger complex that might address our needs as well. And so we've been looking at how can we get the larger housing community to address our needs. while we're trying to wait for the DD housing study to come to fruition next December, and continue to get more money in the housing trust fund. And I'll put the numbers for Representative Macri's bills in the chat.
Thank you, Stacy. And Diana says that she'll give the bill numbers also later. And thanks for asking. Do we have any other questions before we go to our next presenter? I don't see any hands raised. Do you?
And Gabriella, Darla is not here yet. She had another meeting before this one.
Okay.
So she won't be here for a few minutes. So go ahead and start with Scott next.
Okay, thank you. So we're gonna have Scott Littlegood. Sorry, I hope I didn't butcher your last name. Please correct me. Community Residential Services Association.
Okay.
It looks like Aruna has her hand up.
Okay. Do you have a question?
Yes, I do. The question I have is, can you clarify what scattered housing means? I'm still not clear about it, please. Thank you.
Clarify about housing. Go ahead, Stacy.
Scattered housing is a term within the housing world that refers to something that is not a large complex of 300 people, for example. So scattered housing sometimes refers to family housing, housing that is for very specialized groups that might have larger spaces. So multifamily housing, for example, might have 3-4 bedrooms, may have areas for children. It really often caters more to families or other specialized groups. And that's just a term within the larger housing world that seems to better get at the kinds of housing that we would need that is not just an apartment with 1 or 2 bedrooms in a building with 300 apartments, for example.
Thank you, Stacy. So Scott, are you here?
I am here, and I think Melissa, our lobbyist, is just joining. So
that's great. Please take it away.
Sure. Okay. Can you see the screen?
Yes, we do.
Okay, great. So hi, everyone. I'm Scott Livingood, one of the legislative chairs for the Community Residential Services Association, also known as CRSA. Randy Hauk, my co-chair, is also on. I see him on the screen. And I believe Melissa is joining any moment. So we're going to just walk through a little bit about supported living, give you some updates of what our issues are right now, and then end up with what our ask is for this session and how you can help out. And I see Melissa did just join. So supported living is one of the residential models in our state, and approximately just over 4,500 individuals are served in supported living, which is a mix of primarily supported living, people living 1 to 4 people in a home. There are still some group homes, group training homes, and some community protection mixed in with that 4,500.
I'm sorry to interrupt. This is the interpreter. Can you please slow down a little bit?
Statewide, approximately 13,500 employees.
Hey, Scott, this is Stacy. I'm so sorry to interrupt. It's possible you haven't clicked the English button, so you can't hear the interpreter, but she's asking you to please slow down just a tiny bit.
I have not clicked the English button. Okay.
And please, all the people that are joining us just now, could you please choose your language so you can hear in your preferred language the presentation? Thank you. A las personas que acaban de entrar, por favor, elijan el lenguaje en el icono de la parte posterior con el idioma que prefieran escuchar la presentación. Gracias. Thank you. Go ahead. Sorry, Scott.
Okay. So as far as some comparisons, when you look across the different settings, supported living is about $430 per client per day. Solo programs are almost twice as expensive at $856 per client per day. and serve only about 207 people statewide. The RHCs are now down to about 500 people across the various RHCs, and the cost is significantly higher at almost $1,200 per client per day. So our main issue is really the DSP wage and what we're funded at by the legislature. Across the screen right now, you see the green line, which is the statewide minimum wage, which after the initiative was passed, you see significant increases in the minimum wage, now going up to $14.49 an hour. The red line is what's considered a self-sufficient wage, people able to make a livable wage and not rely upon some sort of state or federal benefit. And the blue line is our average entry-level wage. So as you will see, if you go back to just 2008, which was right before the budget crisis and the cuts that we experienced, we were funded 24% above minimum wage and almost 11% above a self-sufficient wage. Today, we are funded about 25% below a self-sufficient wage and only 5% above minimum wage. So that's really our main issue. So as we lose ground with a self-sufficient wage and the minimum wage, what's been impacted is turnover. So now it's pretty customary that every year our turnover is somewhere between 46 to 53%, hovering right around 50%. So what that means is in any year, an individual supported in a supported living sees about half of their staff that support them walk away. The other impact that we've seen is the number of clients served in supported living has gone down. Over the last 18 months, which is obviously during the pandemic, we've lost ground with what the target is that the state sets. So DSHS DDA sets a target of how many people are supposed to be served in supported living, slowly increasing. And you'll see those two lines go farther and farther apart. Due to the low wages, we're having challenge hiring right now, and that's our main issue. You see some of the postings that we're competing with, from fast food to retail to the solo programs. And then supported living is coming in at around $15.26 per hour to start, which can't even compete with any of those others, which beyond just the starting wage, also the benefit packages are far beyond what we're funded to provide. The current situation that we're dealing with going into session is number one, the COVID enhanced rates. We did get extended through the end of March. But that is how far they are set to go right now. We are concerned what 2022 will bring if those end, since we are still in the midst of a pandemic and still suffering some of the ramifications of that. And this funding that we use for enhanced hazard pay, PPE, other supplies is now the new floor for us. Other issues, rates are not tied to the cost of living or minimum wage, so annual increases are not guaranteed and we continue to lose ground. We struggle with recruitment. Typically, open positions were under 10% and we're now over 14% open positions. And many of us fear that once the latest survey is done, it's going to be significantly higher, closer to 20%. So what we're advocating for is continue the COVID enhanced rates, at least through the public health emergency, which that funding has been extended from the federal government through June now. We just need the state to do the same. Permanent and ongoing investment in supported living to bring closer to a livable wage and standardized annual funding increases. I'll turn it over to Randy now to talk a little bit about what supported living experienced during the pandemic.
Yes, hello everyone. So you'll see on this graph here, we're starting to have another uptick in COVID cases, both with clients that we support and also staff that support them. You'll see that we're reaching times of about fall, winter of last year. And even though many of the folks that we support and the staff that we have are vaccinated, still positive cases, breakthrough cases are still happening. And that also means that people are going to the hospital. Maybe not at a high rate like they did before.
Go ahead. Sorry, Scott.
Okay. So as far as some comparisons, when you look across the different settings, supported living is about $430 per client per day. Solo programs are almost twice as expensive at $856 per client per day and serve only about 207 people statewide. The RHCs are now down to about 500 people across the various RHCs, and the cost is significantly higher at almost $1,200 per client per day. So our main issue is really the DSP wage and what we're funded at by the legislature. Across the screen right now, you see the green line, which is the statewide minimum wage, which after the initiative was passed, you see significant increases in the minimum wage, now going up to $14.49 an hour. The red line is what's considered a self-sufficient wage, people able to make a livable wage and not rely upon some sort of state or federal benefit. And the blue line is our average entry-level wage. So as you will see, if you go back to just 2008, which was right before the budget crisis and the cuts that we experienced, we were funded 24% above minimum wage and almost 11% above a self-sufficient wage. Today, we are funded about 25% below a self-sufficient wage and only 5% above minimum wage. So that's really our main issue. So as we lose ground with a self-sufficient wage and the minimum wage, what's been impacted is turnover. So now it's pretty customary that every year our turnover is somewhere between 46 to 53%, hovering right around 50%. So what that means is in any year, an individual supported in a supported living sees about half of their staff that support them walk away. The other impact that we've seen is the number of clients served in supported living has gone down. Over the last 18 months, which is obviously during the pandemic, we've lost ground with what the target is that the state sets. So DSHS DDA sets a target of how many people are supposed to be served in supported living, slowly increasing. And you'll see those two lines go farther and farther apart. Due to the low wages, we're having challenge hiring right now, and that's our main issue. You see some of the postings that we're competing with, from fast food to retail to the solo programs. And then supported living is coming in at around $15.26 per hour to start, which can't even compete with any of those others, which beyond just the starting wage, also the benefit packages are far beyond what we're funded to provide. The current situation that we're dealing with going into session is number one, the COVID enhanced rates. We did get extended through the end of March. But that is how far they are set to go right now. We are concerned what 2022 will bring if those end, since we are still in the midst of a pandemic and still suffering some of the ramifications of that. And this funding that we use for enhanced hazard pay, PPE, other supplies is now the new floor for us. Other issues, rates are not tied to the cost of living or minimum wage, so annual increases are not guaranteed and we continue to lose ground. We struggle with recruitment. Typically, open positions were under 10% and we're now over 14% open positions. And many of us fear that once the latest survey is done, it's going to be significantly higher, closer to 20%. So what we're advocating for is continue the COVID enhanced rates, at least through the public health emergency. which that funding has been extended from the federal government through June now. We just need the state to do the same. Permanent and ongoing investment in supported living to bring closer to a livable wage and standardized annual funding increases. I'll turn it over to Randy now to talk a little bit about what supported living experienced during the pandemic.
Yes, hello, everyone. So you'll see on this graph here, we're starting to have another uptick in COVID cases, both with clients that we support and also staff that support them. You'll see that we're reaching times of about fall, winter of last year. And even though many of the folks that we support and the staff that we have are vaccinated, still positive cases, breakthrough cases are still happening. And that also means that people are going to the hospital. Maybe not at a high rate like they did before vaccinations came into play, but it's still significant. And with that, it reduces the number of people that we have available to support individuals. And so that the 20% that Scott just mentioned, it is definitely happening across the board, across the state. So we are losing more and more people to support individuals. So that also has people get into crisis or contingency operating plans, meaning that we're focusing more on health and safety than a lot of the other activities that we really want to be doing with folks. And I'll turn it over to Melissa.
Great, thank you, Scott and Randy. I'm Melissa Johnson, and I'm the lobbyist for the Community Residential Services Association. Wages for our direct support staff is our top priority, as it has been for at least the last decade, if not more, when we go to talk to lawmakers. So as Scott outlined, our request this session is to, at the very least, to continue that enhanced rate that has been able to support our agencies, to support the clients that they serve. But this is now the floor. We simply cannot go back to what the wage was prior to this federal enhancement. And so that's the basic message we're saying to legislators, is that funding needs to be extended through the end of the biennium. But we can't stop there. That only gets up to about $16.25. And as one of the slides previous said, our staff, our agencies are competing with fast food, with retail that are paying $18, $19, $20 an hour, and our staff is leaving. This is a difficult job, and they can get paid a higher wage for less intense work, and go home at the end of the day and not have to work 2 and 3 jobs. And so we are also asking for an additional rate increase that would get our wages up to $18 an hour. And that's what you see there in that middle box there. That is, and that is just, again, a beginning. When we are talking with legislators, we are asking to engage with us on how to make supported living sustainable, so that we don't have to come back every year and ask for an increase in the budget every time. We need lawmakers to prioritize their values. And the value is that people should be served in their community, and supported living is that model. And so we really need to push lawmakers to put their money where their mouth is. They continually try to see if there are other things that can help, and it really comes down to wages. You see the chart there that describes what Scott was talking about earlier, about just how we've lost so much ground, and this has become a minimum wage job. So what can we do collectively? I know we are all meeting with our lawmakers, and I think the best value that this group can have is that you have a story to tell, and you need to let your legislators know about that. Lawmakers want to hear from you, and we need to have those stories to put kind of a real face on our budget request, because we get caught up in the numbers and the percentages, but what it really comes down to is our clients and the staff that work with our clients. That's really what this is all about. So contact your lawmakers. Email is the easiest in this virtual environment. You know, we unfortunately can't come down to Olympia to lobby our lawmakers in person yet, and tell that story. We have all sorts of backup information that we can help to make your request to your legislators, but that's really what we need the most, because lawmakers are hearing from every industry that you can imagine that is having a recruitment and retention issue with their staff, with their workforce. And so they are getting just bombarded with all sorts of requests. And we need to make sure that they prioritize people with developmental disabilities, because they're just swimming in information from other industries. Even just this morning, I was testifying with several of you on this Zoom on a bill that Representative Sen has to create a center to help direct support professionals in a variety of industries, in recruitment and retention and training. And every single one of us that was testifying on that bill said, you know, that's really helpful, but we need help on wages. And so anything you can do when you're talking to lawmakers about a policy issue, it really does just come back to the state's investment in our direct support professionals.
Much, Scott, Randy, and Melissa for going so thoroughly on the issues and how the importance of having these wages to be raised and also adjusted every time it has to be to have enough people for supported living. We have a few questions, and I see Carrie has her hand up.
There. Thank you, Melissa, Scott, and Randy. I'm Carrie Cunningham Rosvick, and my daughter lives in supported living served by community resources. And we've had a wonderful experience. We feel so very lucky. Melissa, I am in a doctoral program with a focus on disabilities, and I've been doing some research or just looking at the literature about the cost benefit of community-based living, because I feel like I hear what you're saying about telling our stories, but I also think when we're looking at the issues, you mentioned information. I guess my question to you is, do you think that research or literature that looks at the decreased costs of providing services in the community and the enhanced quality of life would be helpful to you or helpful to share with legislators, because they have to make decisions based on the budget, and the research is there. There's not a lot of it, but it is there that says the benefit of community-based living versus institutionalized living.
Great. Thank you so much for that question. And absolutely, we have to have that data to support the narrative that we're telling lawmakers. And so that data, the data about what the cost comparison between SOLA and RHCs is very helpful. I think we need both. I think we come in with the data, but then to kind of bring it home, it's the impact on clients and families that is really what we've found when we kind of hook a lawmaker into being a true champion for us. It's the stories that really bring it home. They appreciate the data and the studies because that backs up what we're saying, but it really is that constituent story that kind of just puts it all into context. So I think it's both.
So if I come across something, should I just forward that to you?
Yes, please.
Yeah.
That would be great.
All right. Thank you.
Thank you. Thank you, Carrie. And I see a comment from Robert, and I see his hand is up. So please go ahead, Robert. Could we stop sharing the screen so we can see all the hands raised? Because it's hard to see. Thank you.
Hi there, this is Bob Wheeler. I'm up in Port Townsend and more involved with adult family homes. But what I'm going to say is that everything that supported living is talking about is very parallel with the concerns we have with adult family homes. We probably should talk more about the issues you're trying to make with the legislation, with the legislators, as well as the issues that we're trying to be involved with the legislators, because I think there's a lot of connection. I put a note in the chat box. I don't see the legislature closing RHCs if there's no way that we can take the folks that are in RHCs and get them into other housing situations. And because there's not enough adult family homes out there for them, there's not enough supported living homes, and the difficulties of even surviving as a supported living or an adult family home. Even SOLAs, there's just not enough community-based SOLAs around the state. You know, to close the RHCs, the legislature is going to have to be convinced that there's some place for all those folks to go, and that it's more cost effective than where they are in RHCs. And I think that's a big battle for us that we need to be addressing and really thinking about. I think probably the most important thing in our eyes here in Port Townsend is this study that's proposed in 5268. And some of that's going on now. I think this is a continuation of that, of what are the needs now and what are the needs going to be in the future for housing for people with IDD, and what are the options that are going to be needed. That study, I think, is critical, because how do you know where you're going to go if you don't know what your needs are going to be? So those needs need to be identified very strongly in a study. Frankly, I think these studies should involve participation of a stakeholder group or an advisory committee that are providing input into these studies. And I haven't seen that listed in this. And I'm concerned about the existing study that's going on housing needs, how much they're going to actually involve citizens and stakeholders in the process, because I think we have a lot to say and a lot of knowledge that needs to go into these studies that are going on. But those studies are crucial, because if you know what the needs are going to be and what types of options you need for housing, then you can develop a plan to how you're going to actually meet those needs. And that's the thing that I haven't seen in some of the housing studies that have been suggested. Is great, you have a housing study that says they're going to be very deficient in providing the housing that is needed. And so, you know, how do you then meet those needs? And I think that's another crucial thing that we have to all be advocating for. So that's what I have to say. Thank you.
Thank you, Bob. Stacy, would you like to share what you put in the chat?
Oh, yeah. I was just clarifying that the DD housing study was in the capital budget last year, and it is already in motion. It's not in 5268. And I have asked for an update on when constituent input will occur and how that will occur. My sense is that right now they're still in the development phase of the study and looking at research, and they've hired an outside consultant, and input will occur in different ways pretty soon. So as soon as we know anything, I'll let folks know. But I agree with Bob that we need a housing plan on the structural parts of what residential supports look like, so that we can, in good faith, ask legislators to invest in us at large amounts of money to ensure that we have sufficient housing. I also put in the chat the other two bill numbers under Representative Macri, who seems to include some housing that might be relevant for our population, for below 30% AMI, for middle housing, and for people with disabling conditions is one of her bills as well.
Thank you, Stacy. Do we have any other comments about this subject? I see a comment from Claudia Coppola. DSHS says the average FH daily rate is 130 their cost, and it costs to the resident 160 per day. And that was a question from Aruna, because she wanted to know the cost of that. And also Andrew Young says, you guys talk about the Special Olympics. And I see that Andrea has her hand raised for a question. I don't know if you wanna say something about special.
Can I speak? Can you hear me?
Yeah, go ahead.
So I am a parent of an individual with intellectual disabilities and behavioral challenges. And in the North Star Project and also in these conversations, there is a small but significant group of families and specifically individuals who are not part of the conversation. And those are individuals with significant challenging behaviors. And they certainly cannot live in an adult family home. And there are many families who I've been speaking with whose core waiver packet is simply not taken by supported living agencies because they have behaviors that just can't be managed in that setting. And so if you are interested in helping us work on advocacy for this, just send me a message in the chat and with your email, and I'll get you connected. I also think that this approach that we're looking at trying to create enhanced behavior support homes might be one option for those who are currently living in the RHCs, because that's obviously the conversation that we're having is we want to close the institutions, and where will those individuals' needs be met? And so some of them may be, in the expanding our current services. And I hope that, there's money for that. But there is also this other population who's have not been involved in the North Star project because they're too busy getting through the day, trying not to go to the emergency department. So I just wanted to speak on behalf of that population.
Thank you, Andrea. Do we have any comments, questions before we go to our next presenter? And please, all the new people that are joining us, we can hear I'm sorry. So I can hear the Spanish interpretation at the same time. So I don't know what's going on. The new people that are joining us, please choose your language in the icon on the bottom where it says languages or interpretation. Las personas que nos están entrando a la sesión, por favor, asegúrense de elegir en el icono el idioma en el que quieren recibir la presentación. Gracias. Ivanova, would you like to take it away and present? I don't know if there's any more questions for Scott and Randy and Melissa. Thank you so much for your presentation. And yes, we will voice all those concerns to our legislators when we talk to them. Thank you so much.
Scott, did you want to introduce Stanley?
I don't think he joined.
Yes.
I was, what?
I'm here.
Okay. And then we'll let Stanley take it away. Yeah, we did have a DSP who was going to speak from their perspective about work in supported living and the challenges with the wages that are paid and the cost of living. So I will turn it over to Stanley. I didn't see you enter.
Okay, thank you.
It's okay. Thank you. Thank you so much. Good morning, everyone. Let me start by saying my name is Stanley Muchahi, and I work for Bethesda Lutheran Communities, and I've been a caregiver for the last 6 years. And I'll just start by saying before years back, caregiving was nice, it was okay, until the pandemic came and things have gone south. I would just say that, of late, since 2020, we've been practicing cohort due to the spread of COVID. So resorting to working one job with a long wage, with low wages, which has led many of the staff change their career. And I've seen some of the staff that we're working with, mostly went to tracking and those kind of things. And this has been a problem because we have been having staffing issues. So the very few who have managed to be left behind, this is because of passion. And as all knows, the work of a caregiver, it is to provide personal care, medical care, That includes navigation through the health system, support with household tasks, and much more. So it has been a challenge, keeping these people alive when you are like 2 staff or 1 staff every single day, working long hours. And it has been a problem because staff have been having burnout every single day and, having, health issues. And sometimes you feel like you have no one to turn to when affected emotional, financially, for working only one job. And, most of us prefer working many jobs. But because of this, COVID has resulted to us working only one job. So this has become a problem, and I would like to request if they consider staffing who are working as caregivers, because personally, I am a graduate of Bachelor of Commerce with accounting option, 2nd class, upper division. So I had a future, but I decided to work as a caregiver because of passion. So there are good caregivers out there who are doing a good job, but some of them are leaving one by one because of burnout, because of wages. It's too much. And afraid I've experienced like the whole of last week working by yourself, and there's nothing else you can do just to keep these people alive. Families complaining that we don't even have time for them. Like every time you're working 16 hours every single day, it is too much. And I hope we'll get a solution for this. Thank you.
Thank you, Stanley. Do we have any questions for Stanley?
There are a couple of comments in the chat for Stanley, Gabriella.
Thank you. Okay, so Stacy, we're very grateful for your support, and thank you for coming in today and sharing. And Doreen says, thank you for your passion, Stanley, and sticking with your people throughout these difficult times. And Joe says, thank you, Stanley, for all you do, wonderful work you're doing. So yes, everybody's very happy that you're here and sharing and your passion. Taylor says, well said, Stanley, 16-hour days are not sustainable. And thank you, Stanley, for sharing our AG provider, Aruna. So yes, everybody very grateful for your work and your passion. Thank you so much, Stanley. And Randy says, Stanley and other DSPs are the true heroes of this industry, and they absolutely deserve a livable wage. Totally agree, Randy. So with this, we are gonna go to our next presenter. Ivanova, would you like to present our next presenter?
Gabriella, you have one hand up with Andrea.
Andrea, do you have another question? I thought she left it up from the last question. Sorry. That's why I didn't ask her, but thank you for noticing. Thank you. Ivanova, would you like to present Darla? Oh, I see Doreen has her hand up. Go ahead, Doreen.
Sorry, I just had one. I thought I put my hand up earlier, but I missed the button or something. I had a question for Scott and that crew. As we're seeing some of these other virtual options, virtual supervision and things like that coming into the picture with DDA and the waivers, where people are having these, electronic supervision stuff happening, how is that helping / hurting our cause? And what does that look like as a combination with supported living services? Is that just like a crisis measure? Does that meet people's needs?
So quite honestly, it hasn't been a resource we've been able to tap into much. It's something the state brought in through one of the waivers during the pandemic. At the same time, we met with the provider that they contracted with, and it just wasn't something that most providers could take advantage of just because of the hands-on nature of supported living and the personal care needs, et cetera, and behavior support needs. We're looking long range that maybe it is something that can supplement what supported living does, but to date, it hasn't been something we've been able to tap into.
Thank you.
Thank you. And so with that, we're gonna go. Ivanova, are you there? I don't see you. I think she cannot hear me. Can you guys hear me? Thumbs up. Yes. Okay. Okay. We are gonna go to our next presenter, and it is Darla from Peace Northwest. Thank you, Darla.
Hi, thank you, everyone. And I apologize for not being here earlier. My presentations got too close to each other. So I wanted to share a little bit today about what Peace is doing and some of the options that we're looking at as we look at housing and residential supports for individuals with IDD, and we're looking at the full spectrum. So everything from individuals who need supported living to individuals that are able to live independently with maybe just a little bit of support in whatever that might look like. So Peace is the nonprofit that I have the honor of working for right now. And we really are looking at how do we create not a service, not a system, but tools to access anything that an individual might need. So I'm a mom, I have lots of adult children, 2 of them experience intellectual and developmental disabilities.
Sorry, Darla, the interpreter is asking if you can go a little slower, please. Thank you.
Thank you, Gabriella. I apologize. What they need as adults, as far as housing and residential supports, has changed over time, and it will continue to change over time. At 19, the level of support that they needed was significantly greater than it currently is now that they're in their 30s. That being said, I can already see my oldest son, who experiences a developmental disability, starting to decline in some ways. So the independence that he has now, he may not be able to continue long-term. I was part of the autism community services group that brought companion homes to the state of Washington. We did that back, I think our companion home, the first one that came was in 2000, or maybe it was 1999. And that's great, but we've not had any new residential models since then. And when we're looking at things, it really, affordable housing is such a huge piece. Even if you're in supported living, you need to be able to find an affordable option. And what does that look like? So Peace is taking this multifaceted approach to this housing issue, in that we really need to be able to help individuals find affordable housing, help match them with the service level that they need, if that's 24/7, if it's an adult family home, if it's shared living or roommate matching, or, you know, is it living individually in an individual setting with supports coming in? Is it an intentional multi-generational housing option, right? All of these different tools, because individuals need to be able to choose what is best for them at any given point in their life. We're working with DDA and to come up with toolboxes and kind of how-tos on how would you access that. Say we want a companion home. How do you go about finding a provider? What type of funding level do you need? How do you set that up? What are the requirements around that? And what are the things that the support system around the individual needs to do outside of what the state requires, right? And that's true for so many different residential settings and residential models. There's several bills that are out right now that may be able to help with some of this. But honestly, I just need to dive into them. I don't have a good feel for those things. But one thing I do know is that there's not one size fits all. And we need as many options for individuals as we have individuals. And it's going to change. I don't want a 19-year-old to be stuck in the same residential housing setting that they have, you know, at 19 as at 45. they need to be able to change and grow just as all of us do, as their skill sets grow. And we need to be able to continue to teach individuals to the best of their ability to learn and to support them in whatever way. The safe homes, someone mentioned the remote supports. That's one tool, right? All of these things are tools in our tool belt. And how do we do that? We've been working a lot with the Housing Authority, trying to get additional subsidized housing set aside for individuals with intellectual and developmental disabilities, working on a federal level as well as on a community level for those settings. So many different things that are, really just that multifaceted approach. We need all of it. We need supported living. We need SOLAs. We need companion homes. We need adult family homes. We need roommate matching programs. We need SOLAs. We need as many options as we have individuals. And I think we're long past the point in the DD system where we can find a box that we call residential or housing and try to put everybody in that box. That's just not acceptable anymore. And yes, someone asked about Pam Blanton. We actually are contracting and working with Pam to continue to do roommate matching. We're doing some grant writing to be able to, there's a fee for Pam service, but to be able to come up with dollars to help cover that fee for a roommate matching and to build those pools up, but also not limiting that roommate matching to individuals with disabilities. How do we connect individuals with disabilities with college students or with seniors? And what does that look like? And how do we expand it depending upon what the individual wants, right? Andrea, you have a question? Oh, that's not a hand raised. Yeah. So I won't say we have all the answers, but we're definitely trying to tackle all of the issues. I've been looking at housing. When I bought my first home back in 1996, I bought it to make sure it was within walking distance to a grocery store, walking distance to a permanent bus route, within the paratransit portion, right? And that was all great when my kids were little, right? But what they needed as they grew up really changed. And so really looking at this and looking at how do we access this? How do we put together vouchers through the housing authorities in with roommate matching or in with our IP providers? Right now, one of our huge issues is not having, and I think Scott addressed this, the lack of providers that we have available in the field to really meet the need. And how do we look at what does that look like? That's maybe where we get creative with some of the roommate matching and some shared living models, right? And what does that look like? Looking at how do we change our local and state laws around the planning issues so that we could have auxiliary dwelling units or more mother-in-law units and different things available so that we can have more people living on the same piece of property. So I can babble for a really long time. I don't have a pretty PowerPoint like Scott does, but I'm curious if you guys have questions or ideas that you would like to share in regards to housing and supports. One of the things that I find just critical, and it doesn't matter what residential setting you're in, if you're in supported living or an adult family home, for individuals to be able to have a full and meaningful life, we need to be able to access all the tools that DDA has available and to understand that they're just that. DDA will not give our sons and daughters or our individuals lives, full and meaningful lives, but they will provide tools so we can help build and create those tools. The next big project that we're working on is how to support what we create after we're gone. My sons are going to outlive me, I hope. That's my plan. And I can set up amazing programs while I'm here to support them. But how do we put that in place so that when we're not here, those things stay functioning. We set up a shared housing. I can give somebody a house. I can set those things in place. How do we make sure all of those things are taken care of when that non-paid support is available? Josie, I see your hand raised.
And we have some comments on the chat as well.
Sorry, I'm on my iPad and things move around. So my situation was very late started when I became an adult. And for one, I ran away. And it's not because I was a runner. It was because I was unhappy. And I even started running away when I was young, like 15. And I told a judge, and I said, hey, don't put me back there. Because if you put me back there, you yourself won't even find me. And I was a spunky child. I said what was on my mind. And sometimes my mouth got me into a lot of trouble. And I made a lot of mistakes. But the housing that I would put in the early years was adult family homes and boarding homes. And I moved around to them a lot. I would probably living in, like, I don't know, before I got my own apartment at 25, probably 10 to 20 different adult family homes. So sometimes it's the person. They might not be happy where they're at. And yes, when I was in adult family homes, I had roommates. When I was in boarding homes, I shared my room, and there was a time that you had to get up. There was a time that you had to be in your room. You didn't have much of a choice. A lot of the time, you didn't have much of a choice of what you ate, when you ate, if you were able to go to the grocery store. And some of the boarding homes even had people who freshly got out of prison. And if you ask the staff to say, hey, can I go to the grocery store down the street? Because at one of my boarding homes, there was a grocery store just down the street. And you had to ask first. You had to, let them know where you were going to be. So you weren't like a missing person or something. The first thing out of their mouth was, hey, will you buy me a pack of cigarettes? Here's $10, While you're there, will you buy me a soda? While you're there, here's blah, blah, blah. Here's $5.70 for running down there for me. And I mean, because the people that were fresh out of prison, they had ankle monitored. They couldn't leave the premises, So it just depends on, is your son happy? Is your daughter happy? Is the person that is in the adult family home happy where they're living? And is it appropriate?
Absolutely, Josie. You said that so beautifully. Really looking at what is it that the individual wants, and that's going to change over time. And, being able to, if you get into a relationship, be able to live with your partner, what do those things look like? And how do we set that up long-term? Helping individuals have real meaningful lives so they can get up whenever they want to get up, go to bed when they want to go to bed, eat what they want to eat, and have a life that's a life of their choosing, right? I know for me, that's what I really want for individuals. Justin.
So
Go ahead.
yeah,
I agree with Josie very much so. I mean, because it's better than living in an institution, right?
Right.
It's better than being in that place that we do not want to be in. So, but the reason why I'm not in the group home or on anything like that is because I like to buy my video games. I like to buy what I want. You know, pay my doctor bills, pay the important stuff. I mean, I get to go on vacation. You know, I got a vacation coming up that I'm going out of the country and stuff like that, and we also get to do those kind of things, and I mean, I know the housing. When you live in your house, you have to take care of it. You have to be able to know what you are doing.
Right,
because
Justin.
when you were living in supportive, when you were living like a group home, they just didn't let you do anything. In my opinion, they just let you like have, oh, you have this schedule, you have that schedule, and you know that doesn't make any sense. That's why I have a support system. So when my parents passed away, and something like that, whatever happens, I know the future, but I know who I'm going to.
Yeah.
And sorry. Anyways, my point is that people shouldn't have to, you know, as adults, live by schedule. They should be able to get to do what they want in their house, in their own home, wisely. So that's basically what I have to say.
Thank you, Justin. I agree. And, you know, really looking at that dignity of risk, right? Learning that, wow, well, you know, am I going to go get my cavity filled, or am I going to spend that extra money on extra movies, right? Knowing that those are individual choices that, while one may have a more significant consequence than the other, those are individual choices that individuals need to be able to make. And how do we support people to do that? How do we support individuals to be able to live the life that they get to choose? And
That's
I
great.
think,
Yes, thank you so much, Darla. I'm sorry for interrupting. We are getting into the other presenters' time, and I see Anthony. Do you have a quick comment or something to say? So
I
Ivanova
was
can
just
take it away
gonna.
to present our
thank you.
next presenter.
So Anthony,
Yeah, I do. I was just gonna tell her real quick that I can relate because my wife was in a group home. She had things stolen from her by the house people who owned it, and when I got into things, I helped her get out of it, get into her own apartment, and then 10 years down the road, we're now married as a happy couple, and we live independently in our own home and stuff. So yeah, it's like we need a lot of people looking in those homes versus just trying to put people in them.
Exactly.
Because there's too much advantage being taken place.
That's right, Anthony. Thank you. Thank you, Darla, so much. Go ahead, Ivanova.
Well, thank you, Anthony. Thank you, Doya. I just look check for anything in the chat. It says, Katrina said, thank you, Josie and Justin. Love this. Bravo, Josie from Andrew. I agree with Josie very much. Bravo to Josie. And then Andrew says that I am happy on my group home. Okay, so thank you for all those who chat. And Doria Holt also posted her email in the chat. So if you want to contact her to get more, question, or you want to just contact her, her email's right in the chat for you there. If there are no other hands raised, which I don't see any others, we will move on to Leo. Take it away, Leo.
Okay. I'm going to talk about one of the options that's available, and that's adult family homes. And in particular, a House Bill 1789 that has been introduced. And this bill provides property tax exemption for property owned by nonprofits that is used exclusively as an adult family home for individuals with intellectual or developmental disabilities. I have a 55-year-old son with developmental disabilities, and I really understand the concern that a lot of senior parents have who have a special needs person living at their home. They're worried about the same things I just heard. What's going to happen when they can't any longer take care of their special needs person? Where will they go? Will there be a family member that can leave their job and take care of the special needs person? If not, will they have the tragic answer of joining the homeless population? Well, again, one answer, and it's not the whole answer. This is a big problem. There needs to be a multitude of options. But one answer is an adult family home. And these homes provide residents the opportunity to be as independent as they can be and have a lifelong, safe, sustainable home. They live in a community that they grew up in. They are indeed a family within that community. There's very great need for these homes, and it's growing rapidly. 2 years ago, Life Enrichment Options had 20 applications for the homes that we're trying to develop. Today, we have over 90 applications. 70% of the people in the state of Washington that are receiving waiver services live at home, many with parents who are in their late 60s, 70s, and 80s. The need for housing is just going to take off exponentially. And hopefully, we'll have some options for people. But get back to House Bill 1789. For 20 years, the Department of Revenue has exempt all nonprofits that serve only people with IDD from paying property tax on those adult family homes. Last year, the Department of Revenue revised its policy and will no longer be exempting some of these nonprofits from property tax. What does that do? Well, the nonprofits already have to do a lot of fundraising. Funds have to be set aside for long-term maintenance, a new roof in 20 years, painting, etc. And for short-term maintenance, replacement of appliances. The additional burden of a property tax really ratchets up the need for fundraising. In King County, the tax could be over $10,000 per year per home. The added burden of the property tax will hinder the development of new adult family homes and puts a financial strain on the existing financial homes. House Bill 1789 will eliminate one of the most significant financial challenges to developing new adult family homes and to the continued operations of existing adult family homes. We need support. We need to have that happen. That's just one small step in helping one of the potential options be sustainable and hopefully able to grow so there are more and newer homes coming on every year. Questions or comments?
Hi, my name is Josie Schindler. I watch the news pretty much every night or every morning, and this was several years ago, but this was up north in Renton or Kent or some weird city up north. And it was a neighborhood. Now I don't know if this is right or wrong, but the neighborhood, everybody, all the house owners discovered that there was going to be a adult family home put in their neighborhood, and all the house owners Googled or researched who is going to be in that adult family home, and they didn't like that idea, and so they all rallied together and they wrote their own little letters and whatever, and they said, we disagree because we don't want those kind of people in our neighborhood. Same with the apartment that is down the street, about a block down the street from TCC. That apartment complex, every single apartment had either somebody who had IDD or somebody with a disability, like somebody just in a wheelchair that was living there, and it was low income. And they told everybody at that complex, get out. You have 20 days to get out and go find yourself a new complex, a new apartment. And it was on the news, to the fact that it was on the news, and it made it so now renters, if my landlord wants me to move, they have to give me not 20 days, they have to give me 60 days to move. Not 30, 60. That's 2 months for me to get out, go find myself a new apartment, or knock on my friend's door and say, hey, do you got a room for me to stay? Because I just got evicted because now they want other people to live where I am living. Because now who's living in that complex that is walking distance from the college? College students. Not people with IDD or people in wheelchairs or people who are low income. It's college students now. And so can a neighborhood fight for their right to say, hey, we don't want a boarding home, an adult family home in our neighborhood because of the kind of people they are? Is that true or not true? Is that law or not law?
It's absolutely biased on their part. And I don't think it's a unique situation. I think it happens a lot. In a lot of communities, people don't understand who people with IDD are. They're human beings, and they let their bias show because they don't know who they are. And that's maybe something that as a community, we have to start looking at and trying to correct. We need to have our city leaders, our county leaders, our service clubs in the different communities get to know who people with developmental and intellectual disabilities are, and that they're real people, and that they're human, and that they're not a blight on the community to be there. And it's an education process. And it's tough because a lot of them have already got their mind made up. But we've got to somehow start changing that. Yeah, this thing for housing for people with developmental disability is really a multi-faceted problem. And if one don't get you, it seems like the next one will. So I really feel really upset that things like that happened, and it just bothers the daylights out of me to hear about it, but it does happen.
Thank you for saying that. Anthony has his hand up.
Yeah, I was gonna say it's like, yeah, I'm kind of, piggybacking off of what Josie said, but it's like, how would some people say, like, senior citizens who've worked their life and then they fall under that assisted living situation, and people say, oh, we don't want you around here, this is our neighborhood. Or if all of us with IDD say, no, this is for us, not you guys, it's like, how would that community feel? It's like, do we have to like make a movie to show we are all equal citizens in this state or something? Because I mean, yeah, I've seen that kind of discrimination way too much, and it's like, we all are human beings. We all share human nature, and we need to learn to work with each other, live with each other, and not discriminate just because we have a disability and everything.
Thank you. Mike has his hand up, and real quickly, we have a chat. Cindy says in the chat, yes, we need to get to know our city council. It helps and talk with our neighbors and friends. They don't realize what we go through, and if more, we might stand up for us. No, it would be easier to stand against. Sorry. No, it'd be. I apologize. The computer's glitching. To stand against those few who try to keep us out. And then Justin says, I agree with Anthony Nass and Josie. Mike Raymond, you're up. So go right ahead. Just unmute yourself. You can unmute yourself, Mike. There you go. Go ahead.
Shut him down.
Agreed, Mike. Shut him down. Thank you. All right. One more in the chat. This is generally speaking, the Fair Housing Act would prevent that sort of zoning discrimination on neighborhood action. That doesn't mean it doesn't happen, but there is legal recourse. Thank you, Stacy, for saying that. Also, so sad that we're still facing these issues. Justin, you have your hand up. Go ahead.
I like the fact that that there's a bill for this for the housing committee, so the people with IDD and elderly people can have a place to live and live their life to the fullest and not have to face segregation and all that stuff. I think it's great, pretty great, because it will show people that we are more than our disabilities. We are more than what our brain is or something.
Thank you, Justin. Thank you, Justin, for that comment. And just one more thing in the chat. It says, I agree that Anthony and Josie said. Thank you, Courtney. I don't see any other hands raised, so I think we should move on to the next presenter?
It's Diana.
Go ahead,
Diana
Diane Staden. You are next, talking about the bills of interest. Go right ahead, take it away.
So I know we're running kind of late now. So I'm just gonna run through these bills a little bit and let you know what's going on in the legislature right now. We've had the budget hearings on the governor's budget proposal, and we're waiting for the House and Senate, who will each release their budget proposals and see what all is included in theirs. But there's some bills that have moved forward. Some of these bills are bills that were last year's bills, and they died during the session last year. But because this is the second year of a biennial session, those bills have a chance to come back again and try and pass. So some of these bills are from last year, and they may or may not be moving forward. And then some of them are new bills from this year. So we have the Occupational Therapy Compact, and that just means that people from other states who are occupational therapists could come here and work, even though their license isn't from our state. And that's House Bill 1610. House Bill 1645 looks at Medicaid payments, increasing them, but just for assisted living and adult residential care. The Dementia Action Collaborative, that's House Bill 1646. That's a work group that was around before, and they want to get that going again. And the reason it's important to us is because people with Down syndrome often experience dementia and Alzheimer's at a much higher rate than other people with developmental disabilities. House Bill 2008 is a new one, and this is part of the North Star priorities that Anthony and Courtney talked about at the very beginning of this. We're talking about housing today, but there are other pieces of North Star that we will be looking at each advocacy day. And this one would say to eliminate using IQ scores to determine eligibility for developmental disability services. We need to look at other alternatives of what could be used to show need other than an IQ score. House Bill 2016 has to do with sexual health education. There was a bill that passed last year about that, and they want to amend that bill to teach students how to avoid being recruited for sex trafficking, since that's been such a high rate of happening right now. And we're looking at, we would like them to amend it to make sure that students with intellectual and developmental disabilities also get included in that education piece. We have companion bills sometimes, which means there's one in the House and there's one going in the Senate. And that Occupational Therapy Compact bill is one of those companion bills that has both. Senate Bill 5529 is self-directed care. This is kind of a new one from this year, and it would remove the requirement that those personal aides, is what they're called in the bill, individual providers that are doing self-directed care, they wouldn't have to be contracted by DSHS. And this has to do with the changeover they're doing in payroll companies for the CDE, Consumer Directed Employer. The Long-Term Services and Supports Trust that was supposed to go into effect at the beginning of the year got postponed, and it would take money out of people's checks every payday to put towards that. But they have a bill that would, if someone has paid into that and they pass away, that the premiums, if they had a dependent who had IDD, that those premiums would be refunded and put into a trust for the person. And we're looking at how that would work a little bit more. We're not quite sure. No paid services caseload. Though we still have 14,000 people not receiving services. And they want to hire 2 full-time case managers for that caseload and help identify the services that those people need for at least within the next year. The personal needs allowance, and I can hear somebody talking, so if you have your microphone on, could you mute it, please? Thank you. Personal needs allowance, there was just a hearing on that, or there's a hearing coming up on that. People right now who live in a residential facility, like an adult family home or supported living, they have a personal needs allowance, and it's based on income. And right now, if you are living in your own home, say you rent your own home, you get less. You get up to 100% instead of the 300% of the poverty level, the federal benefit rate to work from. And we want to make that even so that people living in their own home or any other type of home setting all get the same. 5848 Senate bill is about music therapy and creating a committee to do licensing for that. Under education, the language access bill so that we can get interpreters. That work group is still in that's a bill from last year that's still going forward. The delaying entitlement date for early childhood is also one that's moved forward from last year. The prototypical school formula would help provide more nurses in the schools, which is a good thing for our kids. Excused absences would include for mental health reasons. That's not an excused absence currently, but House Bill 1834 wants to add that. There are 3 prototypical school formula bills, and we don't really have time to go into those, but we'll explain them more on the education dates, the Education Advocacy Day. School attendance, there's 2 bills for that one, for absences and conferences with parents. Promoting the Office of the Education Ombuds, making sure schools are letting parents know about that. Early learning, this is a new bill, Senate Bill 5630, that would include early learning as part of basic education and give us a birth through 8 system that would be really good. House Bill 1782. I know I'm going through these kind of quickly. And somebody muted everyone and it muted the interpreters as well. So just be careful about that, please. I noticed in the chat. And I noticed somebody asked about the emojis. Right now at the beginning of session, a lot of these are new. We're still reviewing them. We have to read through a lot of pages of bills to make sure whether it might have an unintended consequence. So because we've got so many new bills being dropped, it's a point where we have to put under review on a lot of them until we can make sure there's nothing that would be bad in it for our community. Dual services is another big bill, House Bill 1980. Right now in our state, for people with IDD, you either have to choose employment as your service or a day service doing community engagement, getting out into the community. You can't have both. And everybody else in the world, well, at least in our country, goes to a job during the day and on the evenings and weekends, they get to go have fun and do other things out in the community. So we used to have a system where you could have both services in DDA, but it isn't that way now, and we want them to make it that way again so that people can access both employment and community engagement or community inclusion. Sub-minimum wage certificates. Last year, that bill got passed with a huge effort from self-advocates, and there were still a few of the people that were getting those low wages on the certificate. And with that certificate, it only lasted for 1 year. All those certificates are finished now. There are no new certificates going out. And so now they can repeal the statute that allowed people to do that. And the dual services bill was House Bill 1980. Community supports, increasing rates for employment and community inclusion, as well as creating school to work in all counties, because right now it's only in a few of them. And that's Senate Bill 5790. Then we get down to civil rights and legal stuff. Some of these are more, we'll work on them more when we do civil rights next week. I'm just gonna highlight a couple of them. Digital equity is an important one, House Bill 1723. It will increase access and affordability for the internet for people, especially people who are low income. And they will also help teach skills to people with disabilities so that they know how to work the internet and how to get on there. Let's see, Nothing About Us Without Us Act, House Bill 1802. This started with self-advocates and leadership a couple years ago, and they got this bill started as anyone with a intellectual or developmental disability would need to be included on a work group if it pertained to something that was going to affect their lives. And it has kind of evolved from there to anyone with a disability. If they are affected by the outcome of the work group, then they need to have a place on it. And so we're watching House Bill 1802, and that had a hearing too last week. There's a behavioral health work group, and then regular for all work groups, two different bills, House Bill 1890 and Senate Bill 5793. And both of these bills say that if someone who has lived experience, a self-advocate, is included on a work group and they're low income, then they can get up to $200 a day for a stipend, so that if they need childcare or they need transportation, whatever it is they may need to participate in the work group, there would be money provided for them to do that. So we're watching both of those bills too. Under residential, every year we see a bill about using the same provider rate for King and Snohomish County. Those bills are both back again this year. There's some of these that were from last year when COVID was really high and they wanted to not be able to shut people's electricity off, things like that. So we see a few of those in here. 5268, which we talked about a lot at the beginning, is the bill that would provide caseload forecasting for IDD services through Developmental Disabilities Administration. And those are really, that's a really important bill, because if we got caseload forecasting, that would mean the Caseload Forecast Council would tell the legislature every year, this is how many people need services. And the legislature would then fund those services for that many people. Right now, that doesn't happen. It happens for all the other state agencies except for Developmental Disabilities Administration. And then 5606, Senate Bill 5606, is grants for adult family homes that would provide one-time grants up to $5,000 for adult family homes to put air conditioning in to help protect the elderly and people with disabilities that are in those adult family homes when it gets so hot during the summer, because that doesn't seem to be going away. So those are the bills that we have right now. More bills keep coming every day, so we're tracking those. And this bill chart gets updated every week on Monday on our website. And I'll put that address in the chat so that you can always go check and look for the bills that are happening and kind of track where they are. This second to the last column tells you if they're going to have a hearing or if they're going to be scheduled for executive session, which means they move it forward out of that committee. So at this point, I think I will turn it over to Jessica Renner to wrap us up because we're running late today.
Thank you, Diana.
Go ahead, Jessica.
After this briefing, you have many options to advocate with your legislators. You can schedule a Zoom meeting with your legislators, email today's information to them, and watch or testify at a hearing. First, you can email your legislators about bills that are important to you and to set up appointments with them. You can also watch hearings on TVW at www.tvw.org. You can sign in to testify at future hearings. You can sign in pro, con, or other or submit written testimony on a bill. Let me show you how it works. Go to www.leg.wa.gov and scroll down to let your voice be heard. Click on participating in the process. Then click on testifying in a virtual hearing. Choose House or Senate, depending on which committee you want to testify at. We'll look at a House bill today. Select the House button. Then for this morning, let's look at Housing, Human Services Committee, where many of our bills go to. Choose the date and time of the hearing. We'll pick this bill as an example. Then select the type of testimony you want to give. You can do live testimony virtually via Zoom. Just sign in with your position on the bill or submit written testimony. Today we will sign in to testify. Choose your position on the bill, pro, con, or other. Fill out the form with your name, email, full address and phone number. If your name is hard to pronounce, you can sound it out in the pronunciation box. As an example, the pronunciation for Stacy Dime would be Sta, C Dim. If your name is easy to pronounce, don't worry about filling out that box. Usually you will be testifying as an individual. But if you are part of a panel, you would enter your name and info as a new panelist. Then add each person's info who will be on the panel after that. Finally select I am not a robot. After you submit the registration form, An email will be sent to you with Zoom link information. Once you get the email, it has links to add it to your Outlook, Google or Yahoo Calendar. Advocacy Day is a project of the ARC of Washington State and funded by the Washington State Developmental Disabilities Council. Be sure to join us for future Advocacy Days. Register for each Advocacy Day on our website at www.arqua.org Advocacy Days. We want to make sure you are satisfied with Advocacy Days, so be sure to fill out our feedback form. Your feedback helps us to continue improving and helping your voice to be heard. Let's walk through it together. Start at www.arqua.org Advocacy Days. Scroll down to the smiley faces that say your feedback matters and select click here. Start by putting in your email address. Next, you select the Advocacy Day you're giving input for. Then you respond if this is your first Advocacy Day or not. Next you pick the smiley faces that answer how you feel about the virtual Advocacy Day. Then you submit the form. Just as simple as that. Your input helps Diana and the ARC to know what you like, what you don't like, what is helpful, and what is not helpful. You can learn about these and more ideas to get involved on our website at www.arqua.org and click on Advocacy Days. You can also contact us at sale@arqua.org or diana@arqua.org if you need help. Are there any questions?
We have a question from Mike.
Go ahead, Mike.
So far, and we're really pleased to be able to welcome her here today.
What's your question, Mike?
Huh?
What's your question?
I'm not talking.
Okay. Can't hear me, that's why I asked.
Shut him down. Shut the institutions.
Sorry.
Thank you, Mike. If there is no other comment or question, thank you, Diana, for sending in the feedback link. And please, we will ask everybody to answer that feedback, and we greatly appreciate it. And do you have anything else, Diana, Stacy, before we end the meeting? Thank you so much for sticking out with us. It's a little past the timeline. Thank you for all you do. You guys are awesome, and we just need to keep going and talking with our legislators to make things happen. Thank you, and we see you here next week.
Thanks for a great host, Gabriella and Ivanova, and thanks, Jessica, for that great description, and Diana for everything that you do. Have a great day, everybody.
Goodbye, everyone. Thank you for
Thank you.
coming.
Have a great day.
Have a wonderful rest of your day. Bye.